Halo semuanya, saya Ira dari Lavender Medicare. Hari ini saya bersama Dr Ooi Wei Siong dari International Cancer Specialist di Singapura. Dr. Ooi adalah medical onkologis yang sudah sangat berpengalaman dan beliau bisa berbahasa Indonesia. Jadi nanti kalau berkonsultasi dengan beliau bisa lebih mudah. Dr. Ooi, can you share with us more about the difference between chemotherapy, immunotherapy, and targeted therapy?
Thanks, Ira, for having me today. As you can see, we are sitting here in this room, this area where we usually give chemotherapy to our patients. This is actually a chemotherapy chair.
It's very comfortable though.
It is no longer like in the past where people lie in bed and in like a barrack where you have the infusions. Traditionally, chemotherapy is the mainstay of treatment. It is usually given via an infusion in the arm, or it could become in tablet forms, but they are more often in infusion forms. Chemotherapy kills all cancer cells without being very specific. There are of course certain agents more active towards certain types of cancer, but in general they do affect normal cells to some extent, which is why you have slightly more side effects from chemotherapy. Immunotherapy also comes in an infusion form, so you also get it through a needle in the arm. But what they do is it wakes the immune system up and make your immune system kill the cancer cell. So it works more indirect way. And it doesn't have the same side effects as chemotherapy. Targeted therapy is even more specific. In order to use targeted therapy, they are targeted against certain gene mutations. So we need to find out first of all if that cancer has a specific gene mutations before we can use the targeted therapy against it. So one mutation will have one drug that is specifically to block that gene. So for each mutation, you will have a specific drug for it.
What is the side effect that patients usually experience when they have immunotherapy?
The more common side effects generally is maybe nausea, a bit of fatigue, feeling a little bit tired. They usually don't have vomiting, they don't have hair loss, they don't have low blood counts like what we get from chemotherapy.
People say that tablet, the side effect is less than when you're using infusion. Is it true?
Actually, they don't give less side effect because they still get absorbed into the body system, and depending on what they block, right? So what they affect, the type of system, the type of genes that they affect, actually can cause even more side effects than regular chemotherapy. But the good thing is, even chemo or targeted or immuno, we can dose adjust the medications.
So how do we decide which type of treatment to use for which cancer?
For every type of cancer, there's a specific algorithm for it. So most of the time we need to find out, is it an early stage cancer or a late stage cancer? So early stage cancers are cancers that are curable. So we are talking mostly like stage 1, 2 and 3. And late cancers are cancers that spread beyond the primary site. And these cancers are incurable, so they are the types that we need to keep them on treatment for a longer period of time. So, for example, let's say if it's a lung cancer and you diagnose in an early stage, you will get surgery done and then you give a few rounds of chemotherapy because that is the standard algorithm for it. And then we decide whether the patient will need immunotherapy or radiation or target therapy after that.
What are the tests you need before you decide which type of treatment to use?
Firstly, we need to find out the stage, and usually we do this by doing imaging. We can do CT scans or PET scans or MRI scans to find out if the cancer is still in one place or whether it has spread to the liver, the brain, or the bones, or the lungs. So this will determine the stage first of all, and that will then tell us what kind of treatment the patient needs. Then second is the biopsy of the actual cancer itself, because we need to look at the cells under the microscope and then also send the cells, the specimen, for gene mutation testing. This will give us more information on the type of cancer, because even for lung cancer there's a few different subtypes as well. And even under the subtypes, then there are the mutation positive and the mutation negative. So with a combination of the biopsy, the pathological staining, and the gene mutation testing, that's how we will end up deciding what kind of stage, what type of cancer, and what kind of therapy will be needed.
Dr. Ooi, how does my medical history factor into my cancer screening process?
So first of all, we evaluate if you have any risks of developing cancers, your lifestyle, your occupation, and if there's any strong family history, or what other concurrent illness you might have, or what medication you are taking. So all this will be taken in the history, and then we do a physical examination as well. So this will direct us to the type of test scans or blood tests that would be needed to find out if you have any cancer.
Is there a difference between low-dose CT scan and chest X-ray?
When you have a low-dose CT, there is less radiation involved. You won't have to waste time doing a chest X-ray and then get referred to a CT scan.
What type of food can cause cancer? And during the treatment, what type of food that we should avoid?
The only thing that we feel that has any link to cancer is processed food that is linked to colon cancer. So try not to eat too much processed food. If you're going to eat like chicken, just eat the actual chicken that you can see the shape, the original shape, and not a chicken patty or like a chicken in a can, that kind of thing. So I would tell people eat less ham, sausage, bacon, and eat the actual steak or the actual pork chop. Try not to eat things that are like preserved or with added coloring, flavoring and all that, because there's so many chemicals involved, we have no idea what is linked to what. There's a lot of other things that can cause, that contributes to cancer development. It's not just food itself. So, you know, you need to sleep a lot, you need to exercise a lot to keep your immune system in a tip-top condition. In terms of when you're on treatment itself, the only thing we advise patients is that they should eat food that is thoroughly cooked, so that there's nothing raw, there's no germs in it, no chance of getting food poisoning, because it may confuse us whether is it a chemotherapy side effect or is it the food that they eaten that they gave them the diarrhea or the vomiting. So we don't want to have to postpone the treatment because they eaten something carelessly. So usually I tell people not to take soft-boiled egg, not to take sushi, sashimi when they're on treatment. Anything else is fine. I would encourage patients usually eat more protein and vegetables.